Hi, John Armstrong from Advanced Surgical. I thought I'd make a video today for patients considering bariatric surgery. It's obviously a big decision, there's lots to think about, lots to discuss, and just about everybody I see here will have had a good go with diet and exercise. More recently, quite a few patients have actually been trying Ozempic or other GLP-1 analogues with their general practitioner. And this is actually not a bad thing to try. For many patients, they'll lose 5 to 8 kilos if they can get hold of the medication. They may have some side effects, they may try it and fail it or not feel good on it, or just decide they don't want to be on it forever, or they may have read something negative about Ozempic, and then they end up ultimately feeling that they've exhausted everything and they want to have a look at bariatric surgery. There's quite a bit of information on our website at Advanced Surgical. You may have friends or family who've been down this pathway. And it's certainly a really good idea just to talk to them, just mine them for information, see what's happened to them, see what their experience is. There's quite a lot of Facebook groups and blogs out there where people write about their experiences. Sometimes it can be a bit overwhelming. If you do decide to make a consultation, really just come along and have a chat to us. That's all we're going to do. There's no obligation to proceed. At the moment, all our consultations are covered by Medicare, so there's no out-of-pocket expenses for consultations. We can come along, have a chat, and you may feel that it's something you want to pursue. It's helpful if you have private health insurance, and if you do have private health insurance, it's just worth checking that you're actually covered for this kind of surgery. If necessary, ring them up. Our secretaries here can give you the item numbers that are sometimes required to find out whether you're covered or not. Some patients are uninsured, and we go down the pathway with them paying as an uninsured patient in a private hospital. Other patients use super. There are various avenues. But the most important thing is just come along and have a consultation, and we'll work out your BMI, which is basically your weight in kilograms divided by your height in meters squared. And there's some apps out there, I'm sure you can find out how to work out your BMI. And generally, if you as a patient have a BMI of 35 or near 35, we'll probably end up having a discussion about surgery. If patients have a BMI that's very low, around about 30 or lower, surgery is just not going to be an option. It really isn't. So it's quite frustrating. So it's really worth working out your BMI beforehand, before making the appointments. But if you do have a BMI of around about 35 or more, come along, we'll have a consultation. We'll mainly be discussing the procedure of sleeve gastrectomy, because that's what 95% of patients will have at the moment. Again, there's plenty of information on our website and just generally online about sleeve gastrectomy and what it is. If you are deciding to go ahead with surgery, we have a whole team here. We have a dietitian, a clinical psychologist, and another GP with an interest in assisting patients down the pathway and following up patients. So it's a multidisciplinary approach. But my general thoughts would be just to read as much as you can about this topic of bariatric surgery. Exhaust the diet and exercise, try Ozempic and other GLP-1 analogues if you want to, and just give us a ring anytime or contact us online and we'll make the arrangements.